Hi everybody, my name is Tiara. I'm a registered nurse with pediatric experience, some NICU experience, and school nursing experience. We are going to talk today briefly about the flu, since we're going right into the time of year where the cases are going to peak. So I'm just going to go over the flu is, some supportive care, and just fun information like that. But before we get started, just a quick disclaimer that this is just informative information for you guys. Always consult with your pediatrician first and obviously follow their guidance. I also have a little sheet down below me just to make sure I hit the key point. So if you guys see me looking down, that is why. The flu is a viral respiratory infection. Common signs and symptoms of the flu are going to be your fever, cough, congestion, sore throat, runny nose, chills, and body aches. Common symptoms of the flu, as you guys may already know, are going to be your common cold-like symptoms. So that's going to be a fever, body aches, chills, sore throat, runny nose, etc. So I just want you guys to keep in mind that a true fever will fluctuate between 101 and 104. Fevers actually turn the body's immune system on and helps their body fight off any infection or any virus. So fevers are essentially good for the body. Now, treatment on for fevers depends on the child's comfort level. Some doctors will even tell you if they're at a 101 or 102, it's fine to let them be without treatment. I know most parents don't like to hear that and would just feel more comfortable giving them either Motrin or Tylenol to help bring that fever down, which is completely fine as well. Either way is okay. The flu is diagnosed by a quick nasal swab. We all know kids love that. The best way to protect yourself from the flu is by getting your yearly flu shot. So children as young as 6 months can start getting the flu shot every year. As most people don't know that it can take up to 2 weeks to get the full protection from the vaccine. So the sooner you get it, the better, especially before peak season. So when it comes to treating the flu, it's usually just supportive care at home. So that means, you know, making sure that we're staying on top of the fever. If they do have a fever, make sure we're treating it with Motrin or Tylenol as directed on the box. But keep in mind that these fevers can last anywhere from 24 hours to up to 3 days. Sometimes I've seen it as long as 5 days, but your pediatrician will provide you guidance on that. Treating the fever and just making sure that you're staying on top of it, because as soon as the Motrin or Tylenol wears off, you can expect that temperature to spike back up, and that's normal. That's what a fever is going to do. So just making sure that you are treating it correctly. Most pediatricians will tell you not to alternate between Motrin and Tylenol because you have a higher chance of accidentally overdosing, possibly overdosing. So usually Motrin or Tylenol on its own is sufficient, unless, you know, your pediatrician tells you otherwise. So for fever, it's going to be Motrin or Tylenol. For a cough, depending if it's a dry cough or a productive cough, if they're bringing up mucus and phlegm, you actually want to encourage a productive cough because they're essentially bringing that all up. That mucus or phlegm could be yellow, green, sometimes gray, and that's completely normal. It's just a way of the lungs protecting themselves from a possible infection. So just encourage that productive cough. You can also do warm fluids, which will help relax the airway and loosen up those secretions as well. Your best homemade cough medicine is going to be tea with honey, over the age of 1, of course. A humidifier as well will help relax the airway, open up those nasal passages, and just help with their breathing. You also want to make sure that you're pushing fluids, because when they're not feeling well, they're not going to want to eat, which is fine. Their appetite is going to be decreased. The main thing you want to focus on is their fluid intake. You want to make sure that they're still taking fluids, they're still producing wet diapers, because that's going to indicate their hydration status. We want to prevent dehydration. So when they're sick like this, we don't care too much about the appetite. That's fine. As long as they're getting a few crackers, grapes, just something versus nothing, it's fine. But the flu is highly contagious. Has an incubation period of 2 days. So always instruct your children to, you know, wash their hands, cover their mouth when they're coughing, just to help prevent the spread of it in a school setting. A child can return to school or preschool or wherever when they have been fever-free for 24 hours without the use of Motrin or Tylenol, and their symptoms are getting better. Tamiflu, it's an antiviral for those of you who don't know, and it's used to sometimes treat the flu. The CDC actually only recommends the use of Tamiflu for children who are considered high risk. They usually have an underlying health condition, whether it be asthma or chronic lung disease, immunosuppressed. It all depends on the child's history, whether the doctor will prescribe Tamiflu. Usually for low-risk children, the supportive care at home is sufficient. So that is some information regarding the flu. I hope you guys found it informative. Again, if you have any questions or concerns, always consult with your pediatrician first.